when I finished up at the University of Winnipeg, and I was approached to see if I wanted to go on the board and then become the chair of the board. The strategic plan had been worked on, where some notion that there would be a pivoting in part towards a domestic volunteer role. That's what really intrigued me. First, the potential of continuing the work that I was doing at the university with Aboriginal communities on education and training and things of that kind. And secondly, kind of following my own thesis that increasingly we're a borderless world, and why are we dividing international and domestic? Why aren't we going where the need is greatest? We've already have worked on an agreement with the First Nations Health Authority in British Columbia, which are trying to bring together a number of smaller health authorities and create a regional network so that they can begin really providing specialized services and more detailed facilities and things of that kind. And interestingly enough, in the discussions that have been held, one of the biggest demands is not just so much for medical personnel, although I think that might be part of it, but also administrative personnel, logistical people, those who know how to do organizational work and management work. And that would be probably the kind of ultimately volunteer that we would be recruiting, but it would be done in partnership with the First Nations area. And we're going to hold another consultation this fall about the idea of actually setting up a kind of, if you want, an Aboriginal volunteer corps, that we would recruit young men and women from the First Nations, Métis community, Inuit community, and do one of two things. One, have them volunteer to work in their own communities, and secondly, to work internationally with Indigenous people in the Americas and other places to broaden the experience, and then to hopefully develop a network, an international network. The volunteer base for CUSO has been changing quite dramatically. It's no longer the 21-year-old graduate with a bachelor's degree in art to go and teach in Sierra Leone or Botswana. Increasingly, the demand is for more highly skilled accountants or administrators or nurses or things of that kind that would fill in the gap of capacity for many poorer countries. And so increasingly, there was a significant change in the age of volunteers, and also in the kind of role that they were playing. The idea of volunteerism was as much for the volunteer as it was for those who were on the receiving end of the service. Not that the service itself wasn't useful. If you were teaching English to 13-year-old kids in Botswana, that was helpful, that was good. But what you were really discovering was what it was like to live in a totally different culture, different language, and grow within that kind of context. I think in each of those cases, they were being asked to give of themselves in a way nobody had ever asked before, and they found it exhilarating to put their skills and talents to work in a place where they could see the real value, the real difference almost immediately.